Be the best. It's a state of mind. No ordinary job. Making a difference. Written for the forces. Applicable to primary care. Valued by the public. Delivering complex logistical tasks. Exceeding expectations with finite resources. Perhaps putting up a front, a long way from the front line. Out of our forces in out of our settings. How will you know if the patient you're seeing is an armed forces veteran? If you don't ask, you can't tell. People in the armed forces have led very different lives in different circumstances. This leads to different rates of health conditions compared to the civilian population. In the armed forces, access to fundamentals can be fragmented through frequent relocations, short-notice military postings and the nature of military conditions during service. But if you don't ask, you can't tell. If you came across a patient group with significant health differences, you would design a system to ensure their care needs were provided for. So now you ask, what can we tell? Armed Forces Covenant. There should be no disadvantage of access to healthcare as a result of choosing to serve in the armed forces. The Covenant ensures that should a military veteran require NHS care as a direct result of their time in the forces, that their need is prioritised. Urgent healthcare referrals are the same as the civilian population, but the Armed Forces Covenant, enshrined in law, corrects the healthcare disadvantage resulting from service. TILS. The Transition, Intervention and Liaison Service is a rapid access mental health service to meet the needs of the veteran at the level of severity required, from long-term care to crisis, including the complex treatment service and the mental health high-intensity service. It's available within 2 weeks to any veteran in England who's served at least a day in the armed forces, with a registered GP who can produce their service number on request. In North England, the number is 0303 123 1145. Midlands and East 0300 323 0137. London and the South East 020 3317 6818. And the South West 0300 365 2000. Out of our settings can be snapshots, brief opportunities to make that difference for those in urgent need. Ask the question, have you served in the British Armed Forces? Do you think that that's influenced the problem today? It's a done task. You can tell.